Good morning, everybody. This is Elisa Herrera, the Latino Leadership Council Executive Director. Welcome to our 2020 Forum on the Latino Community, the impact of COVID-19 on Latino communities. Next slide. Just a few welcome notes. Si prefiere escuchar en español, haga favor de oprimir el botón para intérprete al pie de su pantalla. Gracias. Next slide. I'd like to first start off by thanking our LLC Board of Directors. What we do is so important that we need a board who is representative of our populations. I'd like to thank our Board of Directors who are listed here and thank them for sharing their lived experience to make a better world for our Latino populations. Next slide. For those of you who don't know, the Latino Leadership Council is the only Latino-focused nonprofit in the region whose team of promotores provide direct services for health, education, and youth. And we do so through home visits, through the evenings, the weekends, and wherever our families need us. Next slide. When the pandemic hit and when the shutdown occurred, I am very proud to say our staff delivered food, masks, and cleaning supplies within a week. We mobilized and we provided food to our families in need. We eventually added children activity kits. We started hosting virtual arts and crafts sessions the way many did. And then eventually we became a big support for our COVID positive families, checking in on them, making sure that they had the disinfectants and they knew how to sanitize their homes, especially for those who had multiple family members living in one house. Next slide. This is our promotores and support staff. I cannot be more proud of them than I am now. They always, every day, they work with their hearts, but during this year, they've stepped up immensely, and I thank them for that. Next slide. And of course, we could never do any of the work that we do without our funders. We're blessed to have Placer County, Sutter, Kaiser, Dignity Health, the Center at Sierra Health Foundation, First Five Placer, and so many of you helping us to do the work that we're doing. So thank you very much. Next slide. We have a poll today because we have 240 attendees. And so that our panelists can understand where our attendees are coming from, I'm going to ask Scott to put poll number 1 up so we can see what kind of services you all provide. Please broadly identify the type of service your organization or agency provides, selecting one. I will give you 15 seconds. A lot of healthcare and human services. I recognized a lot of the attendees on the list. And a lot of you, of course, we recognize from previous forums where you joined us, and we've always had a great turnout at our forums. And we're very pleased that you joined us at this one, our very first webinar of the COVID pandemic year. Next slide. I'd like to introduce you to our moderator, Edgar Ruiz. He is the Executive Director of CSG West, but in the interest of time, I'm not going to read his very long and distinguished bio, but will say that he is directly responsible for the development and implementation of numerous programs and services for legislators and legislatures in the 13 Western states, and of course in Canada and Mexico as well. So I am very pleased to introduce our moderator, Edgar Ruiz, who is a board member, a longtime supporter, a community member, and overall a wonderful human being. Edgar?
Thank you, Elisa, and good morning to everybody. Thank you for joining us to this important forum. The COVID-19 pandemic has exacerbated existing health and economic inequalities in the Latino community. Latinos comprise a disproportionate share of infections across our state, including Placer County. This is due in large part that many Latinos are essential workers in our communities, are more susceptible to underlying conditions, live in multi-generational households, and hold jobs that are not amenable to remote accommodations. In California alone, Latinos comprise 40% of the population, yet make up 58% of COVID cases and approximately 48% of COVID-related deaths. All of this has placed a spotlight on the need for timely information, availability and distribution of resources, and greater collaboration among government, the private sector, and community-based organizations. Today's forum will provide an opportunity to gain insights on the impacts of the pandemic, lessons learned, and what will be required as we continue to navigate through these challenging times. Although a vaccine has been developed, approved, and now being administered, until it is widely available to the general public, the Latino community will need to remain vigilant, promote solutions, and exercise due diligence to ensure governmental entities are responsive to the community. We have two great panelists this morning. Dr. Robert Oldham, who is the director of the Placer County Health and Human Services Agency. He previously served as the county's public health officer and director of public health from 2014 to 2019. Most recently, he was a chief medical executive for Sutter Center for Psychiatry in Sacramento and as medical director of acute psychiatric services across the Sutter Health System in California and Hawaii. And we also have Raul Martinez, Staff Services Manager for Placer County Health and Human Services. In this role, he provides leadership in the areas of organizational strategy, evaluation, and communications. He previously served as director at a California-based research and consulting firm where he led complex planning, research, and evaluation projects for a range of clients. To maximize our time, we will hold off on questions until Dr. Oldham and Raul have completed their short presentations. However, please feel free to use the Q&A function at the bottom to write your questions, and we'll keep track of them, and we'll make them upon them completing the presentations. With that, I will now turn over the screen to Dr. Oldham.
Great, thanks. And so thank you, Edgar. And should I share my screen now?
Yes.
I'm gonna share it. I'm gonna share it for you.
All right, very good. All right, thank you. So thanks, Edgar. And yeah, it's so good to see, at least here on the panel screen, some familiar faces, and to hear there's 240 more of you out there that I can't see right now, but I can kind of see in the chats a lot of familiar some friends from my time back with Placer County. As Edgar said, I took about a year away and worked with Sutter, but I'm back now. Reflecting, I really look forward to this forum every year, and reflecting back on actually 2014 when I started here in Placer County. One of the first things that really where I felt, began to really feel connected to this community was the LLC forum. I remember that one very, very vividly in my mind there at the Flower Farm, and building the connections. So the leadership that Latino Leadership Council takes to build community, not just within the Latino community, but throughout the community is just much appreciated. I know it's really, and we can talk more about the partnership with Health and Human Services, but we just we couldn't do what we do without this partnership. And this forum is one of the many things that I think adds tremendous value for our community. So thank you, Elisa and the board, and everyone who helped to set this up. I'll try to be brief and hand off. So I'm not Raul Martinez initially. We had two of us here, my name in Zoom, but I've luckily staff taught me how to fix that. So, he's much smarter and better looking than I am. So I'll have the pleasure of handing off to him in a little bit. Just on my first slide here, I've mentioned having 240 people listening in. I still, despite all the public presentations I do now, I still get a little bit of performance anxiety, but my blood pressure goes down, by about 10 points whenever I see Maria Cordova's photo. So we use it a lot in our Placer County media, and good to see her here, and look forward to seeing her in the future in person. So next slide, please. So this has been a very unusual year. We're really hitting the worst of the pandemic right now in Placer County. So this slide just shows our current testing positivity rate. So you see a couple of humps there, that one hump back in the summer, which was, I guess we're calling that the first wave. And you're seeing now the testing positivity. So the percentage of tests that are coming back positive in Placer County now up over 10%. So we're actually higher than the state average on testing positivity right now. And this really shows widespread infection. So the take home on this, we'll start talking about disparities, but right now, COVID is everywhere in our community. Next slide, please. But although COVID is everywhere, there are some populations that are being disproportionately impacted. And Edgar kind of spoke to this a little bit earlier, but who's disproportionately impacted? Well, individuals who have certain risk factors. Among those who have lower wage jobs where distancing is hard and they can't work from home. Those who have less room to absorb the loss of income or pay healthcare costs if they become ill. And then those who live in larger households, meaning larger by the number of people in the households, where coronavirus can spread more easily. I would add to that larger numbers of people in the households, but also less kind of square footage we're seeing really contributing to that. In fact, one of the biggest causes of spread in our community is actually household transmission. So we talk a lot about large gatherings being a major driver, and they are, but also, household transmission. When one person in a household gets COVID, it becomes very difficult to prevent other people in the household from also not getting it. And so Edgar was mentioning multi-generational households, which is also a risk factor for transmission to people in sensitive groups like older adults. And then obviously there's this overlap with these risk factors, which could apply to all groups, but racial, ethnic, and class disparities, you can imagine, exist that cause many of these risk factors to have a disproportionate impact on those groups. And so we're seeing those obviously in California, beginning to do some research in this area, and our epidemiology team here in Placer has really helped us to identify some of these disparities as well. Next slide, please. So this statement here, Latinos make up about 18% of COVID positive cases in Placer, yet represent 15% of the population. That there is a disparity there, but that statement, I'm actually, and Raul and others, a lot of people on this call should be very proud of that it's not worse, because it was, right? And so, and I'm looking at Elisa, some leaders who kind of said, no, we're not gonna stand for this. So even though there's the disparity now, without the action, and we'll speak more to that, without the action of this group and our community, it could have been a lot worse. And so we're still committed to try to reduce this disparity completely, but just wanted to point out that this is actually, when I see this, I smile, as opposed to, even though it's still a disparity, it represents a tremendous amount of work on the part of this community. Next slide, please. So Latinos account for 1/5 of COVID hospitalizations in Placer County, which again doesn't seem like that big of a disparity. And again, because we've been able to get the case disparity down, I think this could be also more impactful. I will point out this is not age adjusted, so you kind of think of the major risk factor for hospitalization and death from COVID being age, and we know that the Latino population in Placer County is younger than the population as a whole, and so age adjusted, and it's really complicated to do. But I would just point out that probably the hospitalizations disparity is worse than this graph presents, but there still is one. And the next slide, please. And I mentioned COVID-related deaths. So there, again, you're not seeing as much of a disparity, but again, not age-adjusted on the deaths. And certainly we have seen deaths in the Latino population as well. And then next slide, please. So I mentioned this earlier on the other slide, but really the emerging results from our community collaborations that I mentioned that the back in June, HHS saw an increase of COVID-19 in the Latino community. Again, the Latino community is about 15% of the population. At that time, back in June, was comprising 35% of COVID cases. And so to limit the spread of COVID in this population, HHS partnered with health promotores, and you can see here the dramatic reduction in cases in this population in less than 6 months. So again, kudos to and thank you for all of who helped to make that happen. Next slide, please. And I think I'll end here with the good news about the vaccine coming. And so Placer just this week is receiving its first doses of the Pfizer vaccine. So nearly 7,000 doses distributed initially to healthcare workers at our general acute care hospitals, but then also will start to roll out to long-term care facilities. That'll largely be the Moderna vaccine, and that will go to long-term care facilities through we have partnerships with some pharmacies. But we're also in the midst of assembling a workforce for community distribution of the vaccine. So one of the things and I appreciate your comments and questions later on, is as we assemble this workforce, and we'll put in a plug, we have an open recruitment. So if anyone knows a registered nurse or LVN, please encourage them to go online for part-time employment, right? We have available, and it'll probably be opportunity for some nights and weekends as well. So maybe people who have a day job to do a little bit of extra work and pick up some additional income, but also be part of history. Really, this is going to be the largest vaccine campaign in our history, and some of us were around for H1N1, and this is going to be much larger, probably an order of magnitude larger than the H1N1 vaccine campaign. But as we're doing that and planning it, and this is a good opportunity, kind of a model for us in the future when we do other planning, is to think about health equity, to think about cultural and linguistic considerations that we need to start integrate into our plans now, not wait till after we find problems, but what can we do now, and what lessons can we draw from the scale of COVID has been like nothing we've ever seen. We talk a lot about scale in public health and orders of magnitude, and so this has been, when you talk about, we just had the thousands of tests. We've had, about to approach our 10,000th case, and so the scale is huge. But some of the other things that we've been doing, like contact tracing and community education, what lessons can we draw from those efforts, and to make sure that we reach all communities with vaccine distribution. So I will hand off now to my friend and colleague, Raul Martinez. Thanks, Raul.
And Raul, before you start, I know we have a second poll question here, and maybe if we can put that up. No. And also just to remind folks, please put in your questions in the Q&A. So here's poll question number 2. Once a vaccine is widely available, what will be the 2 biggest barriers preventing Latino communities from receiving vaccines? If you can take a moment to fill in this poll, we'd greatly appreciate it. Okay, get the results. Oh. Fear of vaccination, 67%. All right, Raul, the screen is yours.
Okay, great. So you can hear me okay, Edgar? All right, great. So first of all, thanks again, for for the invitation. Edgar, you talked about this. Dr. Oldham did as well. Just talked about how COVID-19 really has impacted our Latino brothers and Latina sisters across the state, and right here at home in Placer County. And the statistics are sobering. Despite some welcome news, here in Placer County, they are sobering, and sadly, they're unsurprising, right? Especially for those of you who too often have to drop off masks and groceries to Latino families in quarantine. And I know some of you have also made calls to families who've lost a loved one to COVID-19 to offer some measure of comfort. And we know that there's a lot behind the disproportionate impacts, too many to describe in a way that does them justice here. Dr. Oldham underscored a few points around, Latino families, often having those lower wage jobs where they can't work from home, likelier to live, in bigger households, and and if they do get sick, having fewer resources to absorb the loss of income that comes from that quarantine and isolation. And Dr. Oldham also mentioned the COVID partnerships that started to form to meet the needs of Latino families and address the disproportionality in the cases. So I do want to talk about, what those partnerships entail, why they were essential, and what actually made them possible. So when the pandemic first hit in March, which seems like a lifetime ago, individual organizations, including and especially the Latino Leadership Council, responded to the immediate challenges. So Elisa started off sort of ticking off the things that were done, and that included engaging with community members who had tons of questions, yet where there were too few good answers. Steering people to the safety net services that they needed after sudden job losses or reduced schedules, and getting folks whatever PPE, and I assume toilet paper at the time, that they could get their hands on. And a couple of months later, around May, some of the on-the-ground observations made by Latino Leadership Council regarding the COVID effects on Latinos actually started to show up in our local epidemiologic data. And the Latino community, especially those that were living in Lincoln, were experiencing a concerning spike in cases. A number of us, including Elisa, asked about next steps. Now, one of the things I do admire about Elisa Herrera is her candor. And I suspect that I'm not alone in that admiration and how she implored us to get our act together. I'm hoping she was talking about all of us and not just me, but that's possible too. And in June, the share of cases, as Dr. Oldham pointed out, got as high as 35% among Latinos living in Placer, even though we comprise 15% of the total population. So, like Elisa told us to do, we got to work and started to actually stitch together a response that would eventually include the 3 arms of the social impact sector. Now, the county has a lot of good people working for it. Many have logged on today, so welcome and thank you. And a lot of people that also provide culturally and linguistically responsive services. And we're also government and can sometimes be a step removed from important on the ground stuff that's happening in community. So, as nice as we are, and although many of us are guided by a profound call to service, we can't always replicate the role of community partners, nor should we, and the deep connection that they have with community members. So our first task then was to formalize that county nonprofit relationship in June. And really my hat goes off to those with the procurement and finance function who actually helped us get that done fast. And we brought on board health promotores from Latino Leadership Council. A big shout out to Selena Salas and Sierra Community House in Tahoe to serve as an extension of Health and Human Services contact tracing support. So the promotores followed up. They actually continue to do so today. We've actually got a weekly meeting later this morning, in fact. They followed up with COVID positive cases in consultation with our public health staff to reinforce health messages and find out if people needed anything else during their quarantine period. Food, masks, hand sanitizer, which they got from our warehouse. And for those of you who don't know, the great Chris Hazen, who was on Telemundo last week, our warehouse manager, he's definitely someone that you want on your side. And beyond the work with COVID positive individuals and families, the promotores and Pastor Dan Beltran also brought awareness and mascarillas to owners and employees of mercados, taquerias, panaderias, lavanderias, churches, and other places where the Latino community gathers. And in just a couple of months, Latino Leadership Council, Sierra Community House, and the county forged a partnership that really did start to bear fruit, resulting in a notable proportional reduction of COVID positive cases in the Latino community. And yet we knew that we needed more help. So in June, July, and August, none of us at the time knew whether vaccine trials would yield positive results or just how long the pandemic would last, although we did figure it'd last a while. And we had a sense that we needed a more systematic and sort of targeted COVID communications campaign grounded in data and framed specifically to resonate with Latinos. We also recognize that, and all of us here know this to be true too, that the Latino community isn't a cultural and linguistic monolith. And we needed to reach certain age groups, people working in certain jobs and living in specific areas. And to that end, Placer Community Foundation stepped up as that third arm of the social impact sector to support that Masca para tu Gente campaign. Many of you here today are actually supporting that effort. And at its heart, the campaign is designed to slow the spread of the virus and save lives. It's not meant to wag its finger at the community. Instead, it describes how masking up allows all of us to keep working and keep our abuelos y las tías safe, when we see them. And so my, special shout out here to not just LLC, but to Lighthouse, Placer People of Faith Together, Sierra Community House, Chapa Day, Indian Health, and Evangelista Community Relations for supporting the campaign and reaching residents where they are through food distribution boxes and canvassing at 33 affordable housing complexes. Also, as we kind of move forward, it's been a while since we've talked about the state's blueprint framework and the health equity metric. So, it wasn't too long ago that we're all talking about orange, red, and purple. And I think all we see these days is deep purple, unfortunately. But you also might recall that the state did establish the equity metric so that testing positivity in a county's most disadvantaged neighborhoods didn't significantly lag behind overall county testing positivity rates, given the historical disproportionality. So the state, using the Healthy Places Index, identified 19 disadvantaged census tracts in Placer County. And these also happen to be many of the hardest to count census tracts that were informed by our 2020 census work. And the positivity rate in those 19 disadvantaged communities has tracked closely to the overall rate since it was introduced. And in some weeks has actually, exceeded, outpaced the overall county rate, which has been, and that hasn't been the case in other communities, unfortunately, in California. So, there's lots behind it, including our collective effort, and we'll really need to harness that, as we move into the next phase vaccine, as Dr. Oldham pointed out. And I'll just conclude sort of by saying, what made this possible? Like, how did we bring together the three arms of this sector? I sort of see three things. One is trust, right? So any functioning collaboration is characterized by mutual trust. Yeah, sure, frequent communication is important, yet it's not good enough if you don't actually have faith that your partners will pull through to get stuff done. We had a history of working together, including a recent history. We had started to wind down our Census 2020 work with many of the partners I noted, just as COVID picked up steam. And so it didn't matter that the partners represented different organizations and sectors. We viewed ourselves as members belonging to one system, sharing ideas, resources, and pushing each other to reach consensus on a path forward. And we recognize that achieving equity and advancing opportunities for all is hard and necessary work, and you got to start somewhere. So we know that we must improve outcomes, be it the disproportionate impacts of COVID or anything else, on those who are faring the worst or who've been left behind. And doing so helps everyone. It allows us to achieve our vision of a safe, healthy, and connected community in which all flourish. And our partnership took a concrete, immediate issue at hand, COVID impacts, and has saved lives. Yet we must also look at the policy and institutional decisions that allowed these disproportionate impacts to happen in the first place. So that means that we must continue to normalize equity frameworks and act with urgency. Something I think we feel strongly about is to build cultural representation and capacity to create equity experts in and out of government, and to design programs and practices that discourage inequity. So 2020 has been tough on all of us, and yet we should be heartened by how we came together, nonprofits, philanthropy, government, to serve Placer and the Latino community. You've done a lot of good. We've got more good to do in the weeks and months to come, but let's build on our success. Let's deepen our partnership, and let's embrace equity as our North Star. So thank you.
Thank you, Raul, for your, and both you and Dr. Oldham for your presentations. Now we'll move into the question and answer portion of our program. And I know our panelists have already started answering some of the questions that were posted here. I know one of them was about the website website for RNs and LVNs to apply for part-time work, and so you should have seen that, but definitely we'll put it on the chat as well here. It's jobapscloud.com/Placer. And again, we'll put it on the chat. A couple of questions here. With the work of the LLC and that we were doing to help keep COVID-19 low in the Latino communities, what are the possibilities that Placer County Health Department can include them with other health workers to get the vaccine shot? And I don't know, Dr. Oldham, if you want to take a crack at that.
Sure. Yeah, no, I think, I mentioned the initial rollout of vaccine to healthcare workers is really just to our acute care hospitals. And so as the county, that vaccine doesn't come to us. It goes directly to the hospitals, to Sutter and Kaiser. But I think the next round, as we start to get local public health vaccine, there's a prioritization through the CDC and the state government that we have to adhere to. But absolutely, it'll be healthcare workers in non-acute care settings, but also other essential workers. And so I think that would be the place where I would absolutely include, the folks who've been working within the community would be part of that essential worker. And I think we could easily make that argument that they're essential workers, as many others are. But there'll be at that point probably some opportunity. Right now, we're getting lots of lobbying, from different groups to prioritize. There is no line right now for vaccine, so they want to be at the front of the line. There's no line, but I think as we get larger quantities of vaccine and we move into that, past those two initial populations of acute care hospitals and skilled nursing facilities, there will be an opportunity to prioritize at the local level within those groups. And yes, I think it would make sense really for all of our vaccinators. So that's one of the principles is people who are providing the vaccine, we're going to be, to the public for large numbers of individuals. It just seems fair that they get the vaccine, but also not just the vaccinators, but those who are helping to coordinate and do the outreach. So yes.
Thank you. Here's another question. Can you talk about the shortage of Latino or Spanish speaking doctors? How does that affect health outcomes of Latino patients, and what can be done to increase the workforce?
Yeah, I may start, and Raul, please, others fill in if you have other thoughts. But for sure, there is a disparity even in our medical schools. I think that is actually getting better. We're seeing, more progress in that area, but we know from the research that unfortunately the having alignment between the physician and nurses and other health practitioners in both cultural, ethnic backgrounds, language backgrounds, it has an impact on health. And so we know that even when people try really hard to bridge those divides, there's still an impact. And so I think it's absolutely a public health issue to improve the diversity of people who go into healthcare professions. That's why we're actively, I mentioned we posted the link for the RNs and LVNs, but we're actively, we would like to, have people coming to that website all the time for all of our positions within Placer County, because I think it's critical, not just for doctors and nurses, but across the HHS and across government in general. Raul kind of talked about, we're still government, and so we can partner with other agencies to try to make us a little bit less government and have be able to bridge the gap. But also internally, we can change by having people who look like the communities that we serve. So I think we have to do both.
Just to add, in California, not just in Placer, but certainly in California, we need all the health workforce we can get, and we need to diversify that workforce. So there's, as you can imagine, sort of lots of issues in terms of, growing the pipeline. What are the policy levers that you can pull to actually make sort of a career in health and medicine, more attractive, particularly for communities of color. And lots of organizations and really smart people working on it. I know philanthropy, including California Healthcare Foundation, is paying really close attention to that issue. But it's a big issue.
Yeah, Lisa has a point.
Yes, and I just want to say that there's a number of programs that have developed over the years. We do know that we're working with high schools in the area who have health academies, trying to get more youth involved. But of course, we know in our Latino communities, in order to get youth into a program, you really need to talk to the parents. And so we're partnering with the schools to ensure the parents understand what that program is. And then of course, UC Davis, in conjunction with Kaiser, has a prep medical program, which has been highly successful. And they had to do a virtual program this year, but it really brought in a lot of Latino, Latinas into the health field and gave them a pretty intense training on becoming a doctor or going into the medical field. So we know that we have to support those kinds of programs and try to get that information out to our families.
Another question that came here is there a better need to coordinate with surrounding counties, and particularly Sacramento County?
Yeah, I'll say I think there always is. We can always do better at coordinating. I will say Sacramento County, we have a good relationship with. We do a lot of work with them, but all the surrounding counties, we have, with the health officers, we actually meet 3 times a week. And at this point, we have lots of meetings these days, Zoom, and we use Microsoft Teams at the county. We're on those meetings all day, but yeah, we do a lot more coordination now than we used to. In the past, it was really a struggle. I remember trying, coming here, I mentioned in 2014, and looking around and finding some mentors in other counties. But in general, it hasn't been the norm for counties to work across county lines. So I think COVID has taught us a lot of things, and one of them is we just have to do that. But I think we still could do more. But Raul, anything else you'd like to add to that?
Yeah, I would say there's lots of interactions, multiple interactions a week, and sometimes in the same day. So we're tracking with one another. I think the one of the pieces that's sort of challenging is that every health department is also responding to their local dynamics too, right? So there's definitely areas where you look for synergy and cooperation. And sometimes there are different interests, and so you're not able to fully align on all issues, but there's lots of interaction that's happening all the time.
Thank you. I think we have a couple of questions here that go to the issue of vaccination, which is overcoming a hurdle that I think what we've seen. I know the Public Policy Institute of California recently did a survey asking Latinos about whether they would get the vaccine, and about half of them said no. They were concerned, and so that goes into a couple of questions here, and I'll kind of just lump them in. Maybe both of you can kind of just address these. Where do you believe vaccine mistrust from the Latino community comes from, and what can be done to instill trust? Again, polls have found the sizable portion of Latinos and farm workers are hesitant to take the vaccine. And then number two, is there going to be a campaign to push to inform the Latino community that this vaccine will be safe? As this is an issue that, again, has come across the board for individuals that are nervous or unsure about the vaccination.
Yeah, I'll start by answering the last question first, which is yes, there will be. I think that's what we're hoping to get feedback on, is exactly what it will look like, and even as we roll it out, get feedback as far as what's working, what's not. Because as I mentioned, when we've done this with H1N1, that was 10 years ago. Things have changed, but this is at a whole new scale and lots of other factors. It's a lot more complicated operation, but it's critical, right, that we get feedback. How do we do this? I mean, one, we've kind of already spoken to is, partnering, because I think there is a lot of mistrust in government and in healthcare in general, not just government. There's, been lots of historical reasons why there's mistrust there. And so we're not going to overcome that in the next 6 months. And so kind of recognizing that, like, we can try really hard. And that's why it's critical to also partner with organizations who are more trusted, and individuals and community leaders who are more trusted. But at the same time, can we become more trusted and be more trustworthy, right? And so having more transparency, answering questions, kind of continuing to be there, not just kind of a one-time drop-in, but I mean, even the questions coming up in the chat, like if you're emergency Medi-Cal, or if you're undocumented, what is the cost? I mean, that's what people are concerned about. The cost, are concerned about even getting services, and will this have an impact on the public charge debate that we just went through? I mean, so I think there's just a lot of reasons, I'll say baggage, kind of things from even recent events that people are on edge about. And I think we have to be cognizant of that as we push forward. Another idea is having, around the safety of the vaccine, is having trusted messengers out there speaking to the safety, but even like doing things like being seen, getting the vaccine, and talking about their experiences, I think will help as well. But others have additional thoughts.
I think that's right, and and I think the other piece that is going to be difficult, and why we need all of you, all 172 of you that are on this call, on this virtual forum, is also to encourage folks to get vaccine. I think folks have reasons to be concerned. People are getting lots of information from all sides. Some of it is better than others, what one of the things we're thinking about is, how do we take things that we've already done, including the Masca para tu Gente campaign, and start to steer that toward vaccine. And I think the other thing you're going to see and you're starting to see some of it in the media now, is people are going to start to glom on to stories, where folks have, say a negative reaction, right? So is a negative reaction as a result of the vaccine, or is it as a result of something else? And so I think we're going to need to do some pushback, to continue to encourage folks to get that vaccine, and and framing it in such a way that it allows them to go back to work, allows them to see their their families, allows them to return to some sense of normalcy. And my guess would be that the more and more people that get vaccinated, and the more and more people that are able to start to return to sort of some semblance of a normal, even if it's a new normal, you're going to see more people wanting to be vaccinated. So
Thank you. Maybe we have time for one more question here. And that is, obviously with the technology that we're using now, Zoom and others, telemedicine has become an important tool to reach patients. How do you see both the short and long-term use of telemedicine beyond the pandemic, and both as an opportunity, also maybe as a challenge?
Yeah, well, I just right before this meeting was on with our psychiatrists and other kind of providers for the county, and so a majority of the work that they're doing now is via telemedicine, and a lot of them, we actually have an aging workforce, and so it's been, I don't know how we would have survived without it, right? And so it's same, when I was in Fresno prior to coming to Placer County, we actually had almost the majority of our services pre-pandemic were were provided via telemedicine, just because of all the workforce issues. We just couldn't recruit enough psychiatrists living in the Central Valley. So yeah, it's a thing that's not going away. And I think just to help with the workforce issues, it also has huge ability to reach more people, to expand access, not just to kind of plug in our existing workforce problems. The challenge and the worry is that there are certain people, certain communities that get left behind, especially when it moves to kind of telemedicine only, kind of forcing people into a certain model. If individuals and communities don't have access to certain technologies, they don't feel comfortable. But sometimes just people need a direct face-to-face encounter. And so I hope it doesn't give us a pass from being involved in the community and having, local resources available. So I think there's mainly it's good, and it's we're not going back whether we want to or not. But I think we have to also recognize kind of the challenges and making sure that we, the telemedicine was rolled out during COVID. Very haphazard. It was a must. But now I think the challenge is going to be planful and look at where, kind of like with the around schools and kind of virtual schooling, is to look to see where the disproportionate impacts. How can we be more planful and think about kind of the health equity considerations and who's being left behind in this current telemedicine model, and creating a model of the future that actually addresses those challenges.
Thank you.
I would also just note too that, when we started our department strategic planning in 2018, we asked the community to tell us about kind of the top priority issues, right? And those included housing and homelessness, sort of one bucket, a second bucket around mental health, substance use, trauma, and a third being access and navigation. And folks having a tough time, not just sort of getting appointments, but getting to appointments. And it occurs to me that, telemedicine is and sort of telehealth is one way in which to bridge that gap. There's also a digital divide that we need to overcome for that to work well, but it's one sort of piece in the puzzle, so that folks can get sort of the services that they need, wherever they happen to be. And I agree with Dr. Oldham, we're sort of never going back. Not everybody comes to the government center in Auburn, but it's not the easiest place necessarily to get to, particularly for the Latino community, and certainly the barracks aren't always sort of the most welcoming, place to attend and to. So if we can provide, more options, telehealth is one. It's certainly not everything, but that certainly helps us advance our goal to make services more accessible to the community.
Thank you, Raul. Obviously, we're getting short of time here, but we encourage attendees to reach out if they have any questions that maybe were not answered here. We didn't have. Please forward them to Elisa, and we'll get them to both Raul and Dr. Oldham. I guess before we let you go, any last comments from both of you? Obviously, this is an issue that we're going to continue to deal with in the coming months. And any thoughts from you as we continue to work on these issues?
Yeah, I'll just close by saying, thank you not just for the opportunity to speak and for having this forum, but for all the work that you've done and all the work that we're expecting in a continued partnership on some of these issues. So it's we kind of talk about we're probably at halftime right now, and this COVID actually halftime is over, and we're in the midst of this huge second wave, but a lot more of the game still to be played. And so look forward to partnering with all of you. And I'll just end also in acknowledging that the holidays are upon us, and it's a time for us to kind of reflect and think about what a year 2020 has been. I know a lot of us look to the holidays for a time of joy and celebration and connection, but just everyone, please be safe. Try to minimize your gatherings, and both for yourselves and for your communities. If you can help get the word out, to try to virtual, like as we're connecting here, is always best. But if you must, have in-person gatherings, to try to do those outside and mask up and help us get the word out, because that's what we're concerned about, is another wave bigger than this one after the Christmas, New Year's holidays. So thanks again for the opportunity.
And I'll keep this one brief, but one, it's an honor to be asked to be here, and thank you for the invitation. And I think some of the successes that we've seen, it's sort of equity at work, right? And equity is a journey. I think the more that we can continue to build cultural representation and sort of, build our equity muscle and expertise in and out of government, will help not just on things like COVID, but other public health issues, and beyond, for our community.
Thank you both, and thank you for joining us this morning. I want to just, we have a few more items to address here, so hopefully you stick with us here. We do have one more poll to ask, and if we can put that up, Scott. Beyond COVID-19, what other community health issues disproportionately affecting Latino populations require strong partnerships? If you can take a few moments to fill this question. Okay, Scott, you want to put the results? Service, access, and navigation, housing, homelessness, mental health. Thank you. Thank you very much. Well, now I'd like to turn over the screen to our board president and great partner, Herman Barahona. He has some remarks, but also a video he'll show us. And Herman, I'll turn over the screen to you. Thank you.
Thank you, Edgar. I'd like to thank everybody here on the panel, especially the leadership of Elisa Herrera. She's a dynamic leader here in the region, not just Placer County, but really the Sacramento Valley area. And we're very glad to be here. When you're ready, you can queue up the video. Let's see, who's queuing it up for me? Scott, And then after the video, I have a couple more things to say. So hang in there until we will be facing the closing of this event for today. Thank you.
Yo recibí el mensaje que estoy positiva y no entendía realmente si era positiva o no. Yo no hablo inglés. Entonces, ese es uno de los problemas con lo que un latino sufre, de que no sabe leer un texto que viene en inglés. Entonces, tendría que hacer en español para que la gente entienda perfectamente bien lo que es el COVID y que si es positivo o no. Entonces yo sí tardé como 3 días en informarme. Tuve que buscar a alguien que me ayudara. Entonces yo supe que tenía COVID y pues ellos me empezaron ya a ayudar. Me hablaron por teléfono en español. Mi mamá sufre del corazón y hace 1 año ella fue operada. Entonces mi pensamiento fue, oh, tengo mi mamá, no quiero que se contagie ella. Entonces, pues igual tuve que decirle, mamá, yo tengo COVID, no quiero que te acerques. Afortunadamente sí tuve ayuda de concilio de liderazgo latino y ellos me ayudaron con comida, me llevaron guantes, desinfectantes y eso me gustó cuando... De verdad que me alegré cuando me llevaron los guantes, las mascarillas, desinfectantes, porque eso se termina pronto. Lo usas y en menos de 15 días, 1 mes, ya no tienes eso. Entonces tienes que comprar y comprar. Me sentí bien, feliz, porque sabía que por lo menos tenía alguien que estaba hablando mi idioma y podía dirigirme a ellos y ellos podían buscar la ayuda que yo ocupara.
Okay, well, with that story, that testimony tells you what the Latino Leadership Council has been doing in the middle of this storm. They have gone to people's homes, they have provided all kinds of supports. They've even covered people's back rents, you know, as a way to provide and support the mental health services that the county and the Latino Leadership Council provides. I want to thank everybody here for attending this event and this webinar. I hope it's been useful for all of you. What I encourage you, though, is to put your skin in the game. You know, there's only 2 ways to achieve equity, and one is to organize people. The other one is to organize money. And we always ask you to log on to our website and make a donation. Your donation will encourage all of our community members and our staff to continue expanding into the areas where Latinos are not being reached. And these are areas that cover northern Sacramento all the way through the Placer County region. So we encourage you to support us. I want to recognize County Supervisor-elect Rich Desmond, who joined us today. I want to recognize all the partners that have been funding our efforts, our community organizing efforts out there, members of different community organizations. Please stay with us. We will continue this conversation. And hopefully, as we go together into 2021, we'll figure out a better way to collaborate and to improve our emergency response plans and also other policies that improve our equity issues and needs that we have in the greater Sacramento Valley. And with that, I want to thank the members of the board, of course. Thank you, Edgar. Thank you, Dr. Oldham. Thank you, Raul. It's good to see you again. And of course, all the incredible leaders like Elisa and the members of the staff of the Latino Leadership Council. Have a good day. Have a happy, warm, and safe holiday season. Have a good day. Bye-bye.
Thank you.
Thank you.